Air pollution linked to increased dementia risk. New study. Imagine a world where the air we breathe could significantly impact our brain health. Shocking as it may sound, recent research from Cambridge scientists reveals a troubling connection between air pollution and an increased risk of dementia. This groundbreaking study is the most extensive of its kind, shedding light on a pressing global health issue that currently affects approximately 57 million individuals worldwide. Alarmingly, this number is projected to soar to at least 150 million cases by the year 2050. The research, conducted by the Medical Research Council's Epidemiology Unit at the University of Cambridge, meticulously reviewed 51 studies, drawing insights from over 29 million participants who had been exposed to various air pollutants for a minimum of 1 year. While air pollution has long been recognized as a potential risk factor for dementia, this study establishes a clear and statistically significant link between 3 specific types of air pollutants and the onset of this debilitating condition. The pollutants in question include PM 2.5, which originates from vehicle emissions, power plants, and wood-burning stoves, nitrogen dioxide, a byproduct of fossil fuel combustion, and soot, which is released from sources like vehicle exhaust and burning wood. When inhaled, these harmful substances can infiltrate deep into the lungs, leading to a range of respiratory diseases and heightening the risk of cardiovascular issues. Delving deeper into the findings, the study revealed that for every increase of 10 micrograms per cubic meter of PM 2.5, an individual's relative risk of developing dementia escalates by a staggering 17%. Similarly, the risk associated with soot exposure rises by 13%. Alarmingly, in 2023, levels of soot and PM 2.5 at roadside locations in major cities like central London, Birmingham, and Glasgow approached or even exceeded these concerning thresholds. Alzheimer's disease, the most prevalent cause of dementia, currently affects around 982,000 people in the UK alone. Symptoms of this condition can include memory loss, difficulties with concentration, and changes in mood, all of which can severely impact an individual's quality of life. Dr. Henning Kreis, the lead author of the study, emphasized that this research provides compelling evidence, supporting the notion that prolonged exposure to outdoor air pollution is a significant risk factor for dementia in individuals who were previously healthy. She further noted that addressing air pollution could yield long-lasting health, social, climate, and economic benefits. By reducing the burden on patients, families, and caregivers, we can also alleviate the strain on our already overburdened healthcare systems. The potential mechanisms through which air pollution may contribute to dementia include inducing inflammation in the brain and causing oxidative stress, a harmful chemical process that can damage cells, proteins, and DNA. However, the researchers acknowledged a limitation in their report. The majority of the studies analyzed predominantly included white participants from high-income countries. They stressed the importance of future research on air pollution to encompass a more diverse range of participants, particularly those from marginalized backgrounds. Dr. Isolde Radford, a senior policy manager at Alzheimer's Research UK, stated, "This rigorous review adds to the growing body of evidence indicating that exposure to air pollution, from traffic fumes to wood burners, heightens the risk of developing dementia." Air pollution stands out as one of the major modifiable risk factors for dementia, yet it is not an issue that individuals can tackle alone. This is where strong government leadership becomes essential. She continued, "While the 10-year health plan acknowledges the health risks posed by air pollution, much more action is required to combat this invisible threat." Alzheimer's Research UK advocates for a bold, cross-government strategy focused on health prevention, one that unites various departments, including DEFRA, to take a coordinated action against the factors contributing to dementia risk. This pivotal report was published in the Lancet Planetary Health, and it raises critical questions about our environment and health. Are we doing enough to protect ourselves from the dangers lurking in the air we breathe? What steps can we take as individuals and as a society to address this growing concern? Join the conversation and share your thoughts in the comments below. How air pollution in midlife, 45 to 69, accelerates brain aging, new study finds. Imagine this. The air you breathe during your midlife years could be silently harming your brain, potentially leading to cognitive decline decades later. This alarming finding comes from a recent study that sheds light on a hidden risk factor for brain health. But here's where it gets controversial. The research suggests that even low levels of air pollution might be more detrimental than previously thought, especially during the critical period between ages 45 and 69. Thomas Westerholm of Newsweek reported on this groundbreaking research, which tracked participants for nearly 3 decades. The study measured their exposure to nitrogen dioxide and particulate matter, while also conducting cognitive tests. The results were striking. Midlife exposure to polluted air was linked to significant cognitive decline and structural changes in the brain, even when researchers accounted for childhood intelligence and earlier pollution exposure. This is the part most people miss. The implications are profound, especially given the projected surge in dementia cases worldwide. By 2050, the number of dementia cases is expected to triple, making it more urgent than ever to identify and address modifiable risk factors like air quality. As Thomas Canning, the lead author of the study, puts it, air pollution has been called the invisible killer and is the #1 environmental threat to health in the world. Why should you care? Traditionally, air pollution has been viewed primarily as a threat to lung and heart health. However, this study reveals its far-reaching impact on the brain. Midlife is a crucial period when many people are at the peak of their careers, raising families, and often unaware of the invisible risks lurking in the air they breathe. The findings suggest that even modest levels of pollutants can gradually erode memory and processing speed, potentially accelerating cognitive aging. This connection between air pollution and brain health adds a new layer of complexity to the conversation about urban living and traffic-heavy environments. It also underscores the need for more stringent air quality regulations and monitoring, particularly as populations continue to age. The true toll of dirty air on public health may be even greater than we realize, and this study is a wake-up call to take action. So, what do you think? Should air quality be a higher priority in urban planning and public health policies? Or do you believe that the focus should remain on more visible health threats? Share your thoughts in the comments below. Air pollution's link to brain tumors. A deep dive. Here's a staggering truth you might want to reconsider after reading this. Could the very air you breathe be increasing your risk of a life-threatening brain tumor? A groundbreaking study published in Neurology reveals a concerning connection between air pollution exposure and the development of meningioma, a rare brain tumor that forms in the protective membranes surrounding your spinal cord and brain. The science behind the scare. Over nearly 3 decades, Danish researchers tracked 4 million adults through nationwide health registries. They uncovered alarming patterns when comparing pollution levels from ultrafine particles to nitrogen dioxide with medical records of central nervous system (CNS) tumors. What makes this study unique? It's not just about proving association, it pinpoints specific pollution culprits. Cracking the code on pollution profiles. Typical lasting 10+ years, the study used advanced models to map residential pollution exposure, distinguishing between traffic-related and industrial emissions. Key pollutants tracked include ultrafine particles, UFP, tiny contaminants, 0.1 micron that penetrate deep into airways, fine particulate matter, PM2.5, inhalable pollutants, 2.5 microns or smaller, nitrogen dioxide, NO2, a toxic gas from combustion processes, elemental carbon, a marker for fuel combustion emissions. The numbers that shocked experts. Among 16,000 plus CNS tumors studied, 37% exactly gliomas, aggressive brain tumors, 28% exactly meningiomas, traditionally considered benign, 14% exactly cranial nerve tumors, 21% exactly other CNS tumors. For meningiomas, every incremental rise in UFPs increased risk by 10%, while PM2.5 triggered a 20% boost. Surprisingly, traffic-related UFPs showed stronger associations than non-traffic sources, while PM2.5 remained consistently risky regardless of origin. But here's where the discussion gets heated. The study found no significant link between air pollution and gliomas, challenging previous assumptions about universal brain tumor impacts. Even more intriguing, Cranial nerve tumors showed a negative association with NO2 exposure, potentially hinting at complex interactions we don't fully understand yet. Why this matters beyond statistics. Lead researcher Dr. Ola A. Vidfeldt emphasizes how these findings expand our understanding of air pollution's silent impact. We've long accepted pollution harms our hearts and lungs. This study proves it reaches our very brain cells. Long-term exposure to these microscopic pollutants might be altering cellular behaviors in ways we're just now beginning to map. The critical caveats. While powerful, the study acknowledges key limitations. 1. Pollution modeling challenges. Adjusting for overlapping pollutant sources proved difficult. 2. Personal exposure gaps. Address data relied on residential rather than individual exposure patterns. 3. Unanswered questions. Genetic predispositions and occupational exposures weren't fully considered. Call to action: why your voice matters. This revelation comes at a time when global cities struggle with pollution management. The researchers want you to leave with this question: should stricter traffic emission controls be prioritized over current industrial regulations? Post your thoughts in the comments below and consider sharing this crucial conversation with someone who needs to see it. Harry Hackerford, Research Digest Team. Minor funding disclosures: the Danish Cancer Society supported this research. Authors declare no conflicts. Content produced with AI-assisted tools, reviewed by human editors for clarity and accuracy.